share some very interesting things with you, things that I watch for, and that you probably don't have the time to. And I bring these for everybody up at these videos that I do for you, and they're all accessible on MyMycoLab's YouTube channel. And I hope that you will, I'm here to teach, so I'm hoping you learn from what I have to show you and demonstrate to you. And this is all based on medical evidence. So let's get going here. Let's folks are signing up, and we'll get going here. So first of all, let me help you understand what does evidence-based mean? Evidence-based medicine is the best medical and scientific evidence combined with the doctor's clinical experience. So obviously, medical evidence is published studies showing that this actually occurs. It's not opinions. It's not, I have my own way of doing this and I've seen it help patients. That's anecdotal. This is not based on anecdotes, stories, or any kind of so-and-so said to me, etc. This is based on actual medical evidence. Okay, so basically, wrong does not cease to be wrong because the majority believe in it. And would be great for all the folks on who believe in Dr. Facebook. And of course, this was said by the great Russian author Leo Tolstoy, whom I have admired very much for a long time. And then Sir Winston said, if you have knowledge, let others light their candles with it. And that's what we're doing here this evening and late afternoon for you out there. Here's the medical advice disclaimer. And then here is what I do. Notice that the journal pathogens, the invisible enemy fungal toxins, I'm accepting articles on that issue. Solving medical problems caused by toxins. This is the key. It's right here. Very simple, 3 points. Detect the cause, remove the cause, and repair the damage, and the patient gets well. Any kind of toxin, and we're going to talk about toxins. Here's something very significant. Last week, the National Institutes of Health came out and finally showed that mold does cause problems. This is a big issue, folks, that our nation's Institute of Health accepts this. And at the last paragraph, you can see halfway through in the second sentence, third sentence, fourth sentence, some produce mycotoxins, which are substances that can cause severe illness, etc. So, asthma, allergic reactions, and allergic reactions include mast cell activation syndrome, cognitive issues, brain fog, etc., mental issues, immune effects, cancer, etc. All those are part of what the NIH has finally admitted to. I'm so happy that they did. And don't confuse mildew with mold, okay? Mildew is if you leave something out, one of those plastic chairs outside, there's something green that grows on them, that's mildew. And here are the 16 studies that the National Institutes of Health used to put this together. Note number 8. This is one that I wrote with a group of other doctors. If you would like a copy of it, I'd be happy to send it to you. Just let me know. immunedoctor@gmail.com. So here we go. What are the most common misdiagnoses? Fibromyalgia and chronic fatigue syndrome, chronic Lyme disease, autoimmune disease, depression, anxiety, dysautonomia, POTS, breast implant illness. They're all commonly confused. So, what is going on? Here's the Journal of Otolaryngology and Neurotology. Otolaryngology, for those of you who may not know, is ear, nose, and throat, ENT specialty. Dysregulation of the autonomous nervous system in patients with advanced sick building syndrome. So, as you can see in the black box from this study, led by Dr. Tamara Tuminen, a good friend, uh, chronic fatigue syndrome, fibromyalgia, various types of hypersensitivity, such as allergies, food intolerance, sensitivity to chemicals at concentrations tolerable by most of the population, sensitivity to electromagnetic fields, EMF, and even to daylight may associate with mycotoxins. Some of the symptoms experienced by patients with advanced mold-related illness, such as fatigue, memory and cognitive impairment, and somnolence, which is sleepiness, are like those reported by the silicone breast implant patients. There you go. And as some of you may know, I've already published with other doctors together. We've published over 22, 23 studies on silicone breast implants and also on saline breast implants. So now let's get going down. Here's what this said. This study that I just showed you said neurological manifestations in patients with postural orthostatic tachycardia syndrome, POTS, myalgic encephalitis, chronic fatigue syndrome, chronic regional pain syndrome. These are all conditions that may associate with advanced mold-related illness. Now I want to take you on to one of the other big misdiagnoses. This is a study just recently published from Johns Hopkins University School of Medicine, Mistaken Identity. Many diagnoses are frequently misattributed to Lyme disease. So look at the results of 1,261 patients that were referred for Lyme disease. 1,061, 84% had no Lyme disease. Okay? So what does that mean? That means that there's all these doctors out there doing the wrong test, telling patients they have Lyme and putting them on all kinds of high dose antibiotics, ruining their microbiome, etc., etc. So let me show you what that means. Here's a study published, and it says, what are unsuitable diagnostic tests for Lyme? Okay, polymerase chain reaction, the second one on this list. What is that? That's PCR test. That's vibrant. The fourth one, enzyme-linked immunospot assay, ELISpot. That's IGeneX. These are unsuitable diagnostic tests. Don't use those to diagnose it. The only test that is acceptable for diagnostic purposes for Lyme is the one by Immunosciences Laboratories. So let's go on. Inflammatory bowel disease. What does that mean? That means SIBO, Crohn's disease, ulcerative colitis, irritable bowel syndrome. Okay? All these strong evidence is provided by a well-designed study showing that the mycotoxins deoxynivalenol has the potential to induce the onset of all these inflammatory bowel diseases and ulcerative colitis. So what do? Do you put them on these medications that quell and quiet down the inflammation but doesn't cure the disease? It just treats the symptoms? No, folks. Remember what I showed you in the beginning. Remove the cause, repair the damage, and the ulcerative colitis, Crohn's disease, SIBO, etc. are all gone. Let's talk about the inaccuracy of urine tests. Well, there's some new information there. This is AI Google. Urine tests for mycotoxins measure levels of mold metabolites to assess potential exposure. Notice it says mold metabolites, not mycotoxins. If you look at the test results up on the left hand of the urine test on the upper left-hand side, it says metabolites. What are those? It's not mycotoxins. For example, if tomorrow at lunch you eat asparagus along with other food, your urine the rest of that afternoon will smell of asparagus. We've all noticed that. Well, that's the metabolite. It doesn't mean you're sick. That just means the metabolite is being excreted in urine, and urine is an excretion. So that is correct. It is important to note that the CDC and FDA do not endorse these tests for clinical diagnosis. The urine test is not accepted for clinical diagnosis. Blood serum antibody testing is considered more accurate for detecting mycotoxin exposure, as published studies have shown urine testing to be invalid. So all of you doing urine testing still, look at this information. And what does the CDC say? CDC says the use of unvalidated urine mycotoxin test. It's not, mycotoxins tests are not approved for accuracy or for clinical use. Urine mycotoxin testing, okay? So let's look at this. This is a study published just April, last month of this year. You can see the study down at the bottom. This study highlights the challenges involved in modeling the relationship between urinary excretion of T2 toxin over time in humans. The findings indicate that approximately 20% of the external exposure can be traced back in the urine within 24 hours, meaning that 80% is inaccurate of the urine testing. And what about finding itraconazole in urine? This study shows the following. Albumin is the most abundant plasma protein in the circulatory system in the human being. Albumin ties ochratoxin A with unusual high affinity. Therefore, 99.8% of ochratoxin A is an albumin-bound form in the human. That's you and me. Due to the strong albumin binding of ochratoxin A, its elimination by glomerular filtration of the kidneys is negligible. Studies verify that the toxin is able to be reabsorbed from practically any part of the nephron in the kidneys, both by active transport and by passive diffusion in a pH-dependent fashion. What does that mean? That means when these test results from urine show you have ochratoxin, you can't. It's a false test. It is inaccurate and invalid. So look for body burden of chemicals, not chemicals coming out of my urine. Look for body burden of mycotoxins, not mycotoxins in urine. This is from Dr. Vrzdani. And here's something else from Dr. Vrzdani. The use and limitation of organic tests for gut health, a complete guide. Several popular urine organic acid tests claim to detect imbalances in gut bacteria and fungi, molds. But most of the microbial markers on these tests do not measure what they claim to. This study was published. And what does the latest study on comparison of urine versus serum for mycotoxins show? Well, that the ELISA, enzyme-linked immunosorbent assay, that's ELISA, method to detect mycotoxins in human serum comes with, look at this, folks, very important, significant accuracy, precision, and specificity. This is written in the journal Toxins and published there. So, and what is the test with the significant accuracy, precision, and specificity? It's MyMycoLab's test for 14 different mycotoxins, IgG, indicating a current toxic reaction, and IgE, which tells you if you're currently being, if there's mast cell activation. 14 different mycotoxins, 28 test results in total. Here's an example of this woman in her late 30s, and this is the left IgG and the right IgE, indicating she both has a toxic reaction and she's really being exposed heavily. And look what happens after treatment, which I'm about to reveal to you, after 6 months of treatment. How much it's died down. Almost very little here, very little here. Almost all gone, although it was very high 6 months before. What is the correct treatment? Apply the first, you begin with the first rule of toxicology, and that's get the patient away from the toxin or the toxin away from the patient. That's the first thing you got to do. Every person's health cannot be restored if they continue to be exposed no matter what the treatment. So they've got to have that first taken care of before they can really even start treatment. What about chronic sinusitis? So in chronic sinusitis, this is a Mayo Clinic study. Dr. Ponikow, chairman of the Department of Ear, Nose, and Throat Surgery, published this study. He did this on 210 patients. 96% had mold. Treatment, intranasal amphotericin B, reduced the inflammatory mucosal thickening on both CT scan and nasal endoscopy. The study was published, and you have it down below so that you can always look it up. Now, if you want more information on this, immunedoctor@gmail.com. Immune spelled out, doctor spelled out, all one word, @gmail.com. Do you take a lot of supplements? 20, 30, 40, 50? Like some of people who send me emails tell me they're taking that many? Let me show you this. A recent study found that 11% of nearly 60 tested supplements actually contain an accurate amount of the key ingredients listed on the label. 40% did not contain a detectable amount of the ingredients at all. 40%, folks. So all these people taking 20, 30, 40 or more supplements, they come to me and they have a shopping bag full of supplements. And I toss it all out. I'll tell you why. Here's heavy metals and supplements, an analysis of 40 dietary supplements for the presence of lead, arsenic, mercury, cadmium, and pesticides found trace amounts of one or more of these in 93%. 93%. If you're prescribing supplements, Do you know what's in them and what they contain besides what they say they think they contain? So that is a very significant point. And another study reported botanical supplements. Well, like people love, they think that mycotoxins and molds can be affected by oregano. Let me tell you, folks, if that were true, not a single person in Italy would have any problem with molds, and that's not the way it is. Well, botanical supplements contained plant species not listed on the label. And on top of that, active ingredient substitution. They would switch out one active ingredient for a lesser one, was observed among 83% of the companies tested. This is published in the American Journal of Public Health. So you see the problem with too many supplements. Now, what about protein powder supplements for different desired uses, including muscle building and weight loss, meal replacement? These supplements include ready-to-drink liquids, as well as dry powders that you mix with milk or water before you drink them down. Well, what did the study show? There was concern that there was heavy metals, arsenic, cadmium, mercury, and lead in these products. And the Clean Label Project reported that 70% and 70 to 74% of the tested products contain measurable levels of lead and cadmium. And those are not good things to have. Here's a book by Dr. Hal Huggins, Doctors Hal Huggins and Doctors Thomas Levy. Dr. Tom Levy is a brilliant man. He's a board-certified cardiologist and an attorney. I know him. He's written wonderful books. And he wrote this in one of these books: seafood, especially fish, deserve a separate mention here. Fish contain large amounts of mercury. Even worse, the mercury is in the form of methyl mercury, a form of mercury up to 100 times more toxic clinically than inorganic mercury vapor coming off the amalgams in your teeth. Biologically speaking, there is no safe levels of mercury. Zero exposure would unquestionably be the best level, and the same goes for mycotoxins. Folks, all of you that love sushi, ahi tuna, sashimi, and all these things, I hope you get the message about heavy metals. And it's methyl mercury, which is 100 times more toxic. Here's a study published on glutathione and Parkinson's disease, and it provides evidence that glutathione is associated with the pathophysiology of Parkinson's disease, meaning glutathione can cause Parkinson's disease. Be careful with glutathione. So, folks, here's neurotoxicity about T2 toxin. It's able to cross the blood-brain barrier and accumulate in the brain. Gliotoxin, which is a well-known mycotoxin and which MyMycoLab tests for, increases in the presence of glutathione. Gliotoxin toxicity gets worse if you give the patient glutathione. This is another published study. Here's a myth. Mycotoxins colonize the gut, so you have to pull them out with binders. Oh my God, what a myth. Well, let's look what the studies actually show. Binder types of substances include inorganic materials, for example, kaolinite, clays, activated carbons, zeolite, bentonite, etc. Such adsorbents are highly capable of neutralizing aflatoxin, and that's it, one, which doesn't occur indoors, only in outdoors. Well, what about however, they are relatively ineffective. They don't have any effect in cases of other mycotoxins. In addition, they also bind vital vitamins as well as macro and microelements. What are these macro and microelements? These are elements such as zinc, such as magnesium, etc. You don't want to take binders. They're about, oh, but my patients get better. I'm not looking for people to get better. I know if you have a bronchopneumonia and you've got a fever of 104, I can put you an IV in you of just plain normal saline for an hour and your fever will come down, etc. But it's not going to cure you. It's only going to make you temporarily better. And I don't want to be temporarily better patients. I want cured patients. Here's another study. Some physical strategies, such as the application of adsorption agents, binders, presented no sufficient effect against mycotoxins. All right. So there you have it, folks. Here's a healthcare provider, and she said, I am a healthcare provider. And I've recently come across MyMycoLab's information. Thanks so much for the help you provide. I do really appreciate all the great information on the website, especially the YouTube videos. Knowing that my own family has been exposed, we all just recently had our blood serum tested and are waiting for those results. As someone who has previously tried the holistic route, I can say for certain that it does not work. Folks, you all who's out there who think taking just supplements and vitamins is going to get a toxin out of you, obviously this lady tried and it does not work. Let's look at the real thing. The 6 months detox program consists of 4 steps. The treatment consists of 4 parts. And if any part is modified, you want to add a little this, you want to take out a little that, you want to put in a little quercetin or whatever, or if any part is left off, the rest will not work. It's like a 4-legged table. So 1, before you can do any treatment, remediate the indoor environment so there are no toxic molds left, or remove yourself from the toxic mold environment. Go somewhere else. Do not start treatment until this is accomplished because it will not help. Second, number 2, itraconazole, 100 milligrams, twice daily with food. Number 3, 8 specific supplements and vitamins at specific doses, as demonstrated in published medical studies. What do I mean? Oh, here, take some of this at this dose. No, it has to be very specific. And you can get this from this company called detoxpure.com. They have it all in one box. And last, number 4, a low histamine, anti-inflammatory nutritional diet. This entire treatment lasts about 6 months. Usually no one feels any different for the first 2 months because you're so far in the negative with these toxins. And remember, mycotoxins are molecules, just like lead is a molecule, just like mercury is a molecule, just like glyphosate is a molecule, etc. Then around 10 weeks into the treatment, that's when people start saying, I notice this, I'm better with this, I don't feel this anymore. And at around 6 months, the patient should feel significantly better. And a few patients become better before the 6 months is up. I'll show you in a minute. The testing has to be repeated at 6 months. With 6 months of treatment. Okay? So, number one, get the patient away from the toxin or the toxin away from the patient. Itraconazole, 100 milligrams twice a day with food, 8 specific supplements and vitamins at specific doses from Detox Pure, a low histamine, anti-inflammatory nutritional diet. And that is basically all you need. So let's look at itraconazole, because all these people are saying, oh, my eyeballs are going to fall out, oh, my hair is going to fall out, my brain's going to shrink. Well, let me talk to you about the brain shrinking a minute, because that's one of the favorite things Shoemaker says. Yes, your brain is inflamed. You start taking itraconazole, and there's less inflammation, so the brain goes back to its normal size. Obvious. Itraconazole is an antifungal agent. This is from this study published. Broad spectrum activity. It's well tolerated and highly efficacious. It produces consistent plasma concentrations and are ideal for the treatment of systemic fungal infections in a wide variety of patient populations. Itraconazole treatment can be specifically tailored for use in all patients, including children, and those requiring intensive care as well. So it's a very safe drug. Well, here's another study. Again, look at what's underlined. Itraconazole has been well tolerated with doses of up to 400 milligrams per day, being generally free of serious side effects. So lastly, it's a common antifungal agent that was developed in the 1990s. It's been in clinical use for 35 years with an established safety record. This was published in 2017, 8 years ago, so now it's even 43 years of established safety records. Now let's look at fluconazole, diflucan. Fluconazole has limited spectrum of activity. For example, it is not active against Aspergillus and several species of non-albicans candida. So here is the story on fluconazole versus itraconazole. There's 2 types of molds, single cell molds and multiple cell molds. Single cell molds are all the yeasts, like candida, like baker's yeast, brewer's yeast, etc. And fluconazole works against the single cell. It does not affect multiple cell molds like Aspergillus, Stachybotrys, Penicillium, Cladosporium, or Fusarium, etc. But itraconazole kills both single cell and multiple cell molds. So obviously, you need to use that one. Now let's look at some key factors in the supplements that you need to take. This is a study on curcumin published this year in January, a potential detoxifier against chemical and natural toxicants. Toxins affect the various parts of the body. Well, we know that. Curcumin is a medicinal compound with different biological activities, such as it's an antioxidant, anti-neoplastic, which means against cancer, anti-inflammatory, and antibacterial. What else? Curcumin and the detoxification of mycotoxins, heavy metals, carbon tetrachloride, drugs, alcohol, acrylamide, etc., etc. It's well tolerated and safe at high concentrations with no evidence of toxicity. Let's go to melatonin. Okay, people think it's only for sleep. It is not. With aging, the nervous system gradually undergoes degeneration. We all know that. Okay? So let's look at what it says. Alzheimer's, it helps in, okay, Alzheimer's disease, Parkinson's disease, Huntington's disease, ALS, amyotrophic lateral sclerosis, which is Lou Gehrig's disease, and it helps in all that. Melatonin is a neuroendocrine hormone mainly synthesized in the pineal gland in the brain and has a wide range of biological functions: sleep control, regulation of circadian rhythm, immune enhancement, metabolism regulation, antioxidant, anti-aging, and anti-tumor effects. It can prevent cell death, reduce inflammation, and block calcium channels. So there you go. Human melatonin, I hope you understand how important melatonin is, especially in this slide, because it's interesting. Human melatonin secretion generally decreased with increased age. The human pineal gland secretes melatonin from 3 months after birth. It peaks at 6 years old and decreases to adult levels starting at age 12. So there you go, why you need it, not for sleep. What about phosphatidylserine, PS? That's called phosphatidylserine, is known as PS. Clinical studies have shown that it has no side effects and is well tolerated. It's an important supplementation for different central nervous system disorders, including autism, Parkinson's disease, Alzheimer's disease, major depressive disorders. One supplement. Chronic neuroinflammation is implicated in autism, Parkinson's, Alzheimer's, and major depression. And it's supplementation with phosphatidylserine can inhibit excessive neuroinflammation and play a protective role of your brain. It can improve your cognitive function. Well, I want some of that. Let's look at magnesium. That's one of the other 8 supplements at specific doses. Magnesium is the 11th most common element in the human body. This master mineral is necessary for approximately 350 enzyme systems and therefore playing a role in the majority of the body's metabolic processes. Up to 80% of the population are deficient. 80%. So if there's 10 people listening, 8 of you are deficient. Magnesium binding sites have been detected in 3,751 human proteins that are essential for building, repairing, and maintaining your body's cells. That's how important this is. By the way, as far as magnesium is concerned, if you don't have enough magnesium, you do not absorb vitamin C, which is very important. We'll go into that. Here's vitamin D3. It can be very helpful in cognitive impairment, vascular dementia, Lewy body dementia, and other conditions that develop due to brain cell malfunction or cell death. Low vitamin D levels are associated with increased cognitive impairment, diabetes, cardiovascular disease, cancer, and respiratory diseases. Well, folks, you need vitamin D3. What about B complex? It's a group of 8 water-soluble vitamins. And all of them, all 8, are particularly prevalent to numerous aspects of brain function, including energy production, DNA and RNA synthesis and repair, genomic and non-genomic methylation, and the synthesis of numerous neurochemicals and signaling molecules. Furthermore, human research clearly shows that a significant portion of the population of developed countries suffer from deficiencies or insufficiencies in one or more of this group of vitamins. And that in the absence of an optimal diet, administration of the entire vitamin B group, rather than small subsets, a little bit of vitamin B12, a little bit of B6, etc. No, the whole thing together at doses greatly in excess of the current governmental recommendations would be a rational approach to preserving brain health. Hell, what about probiotics? Publications from Reading University by Dr. Simon Cutting with the Food Safety Authority of the United Kingdom. That's the FDA of England. Showed that less than 10% of the usual commercial strains of lactobacilli, bifidobacterium, and probiotics are able to get to the gut. Well, let me tell you folks something. When you go to the supermarket and you grab yogurt or kefir, and it says it has this and that probiotics, let me explain to you that all dairy products in the United States have to have one thing in order to be sold, and that they have to be pasteurized. If you have a farm and you sell non-pasteurized milk, there's going to be black SUVs arriving with men with blue jackets and yellow letters on the back of these jackets, hauling you off to places you don't want to go to. So, isn't it interesting? They have to heat yogurt and kefir to a point where it kills all the bacteria. Makes you think. High doses vitamin C can quickly neutralize a vast array of toxins, such as mycotoxins, drug overdose, alcohol, barbiturates, amphetamines, dangerous chemicals, for example, aromatic hydrocarbons, cyanides, arsenic, mercury, lead, pesticides, and herbicides. That's why it's part of the 818 specific supplements at specific doses you can get from Detox Pure. Here's a lady that I treated. This is her on the left in October. She specifically asked me not to take the, put a black over her eyes so she can't be identified. Here she is. Look at the face of a woman suffering. And here she is on the right in April. In 6 months, she was treated. She's the wife of a dentist. So I'm showing you these pictures now. On the left is this young woman, 30 years old. Look what her skin looks like. It's all over her body like that. And look what happens after treatment. Here is SIBO. Yes, not antibiotics. Itraconazole. Here is two autoimmune diseases. The finger shows rheumatoid arthritis. The skin shows psoriasis. Here's this gentleman's abdomen and chest and his finger. Psoriatic arthritis. Here's what he looks like. 6 months of treatment for mycotoxins, folks. That's all it took. Here's the mother of a well-known speaker at medical conferences, a doctor. He asked me to help her. Here's what he sent me this pictures of what her legs look like with psoriasis. Here's the before and after. Obviously, she took these with her cell phone. Here's a cancer, because we know now that a large number of cancers are caused by mycotoxins. The left two pictures show this man's forehead with this massive cancer growing. Day 59 of itraconazole. Look at the cancer. So here's a patient. Abdominal pain and breathing problems gone in 3 weeks. I was seeing miraculous results after the first 3 weeks. For the past 25 plus years, I have needed to use an inhaler 2 times a day. and a nebulizer every 4 to 6 hours from October until May. After following your paradigm for treatment for a couple of weeks, the brain fog was gone, no more abdominal pain. I packed away the nebulizer. Very direct and very precise. Here is this healthcare practitioner. It has recently come, and look, the point is, as at the bottom, as someone who has previously tried the holistic route, I can say for certain that it does not work, and I can say that for sure. And this is from a doctor who came to A4M in Las Vegas and listened to me lecture there. And Dr. Campbell, I'm simply blown away with your knowledge base. After hearing you at A4M, I dove into your videos and I wish I had met you years ago after getting sucked into the Shoemaker Nathan vortex. At least going forward with your direction, I will be able to truly help my complicated patients. So, folks, now I'm going to open it up to the chat and let's see what questions you have. If a patient with IBD is on immunosuppressive medication, which would make mold testing invalid, would you recommend starting mold treatment? No. You're taking an immunosuppressive drug. It's going to wipe out anything you do. You're treating symptoms. You're not treating the cause. You need to get off that medication for 2 months, do the test, and then treat the cause, and then it'll go away. IV ozone and glutathione plus supplements. It won't alter the blood work, but there's no evidence that ozone does anything, and glutathione can cause problems. It can make gliotoxin more toxic and can cause Parkinson's disease. Patients who have ulcerative colitis with pain, bleeding, and general symptoms, do you recommend doing some gut healing first to stabilize and then starting, or start right away? Well, first, I would do the test to see what it is that you have, which mycotoxins and how much. How do you prepare your body for detox or die-off when taking itraconazole, especially for people whose bodies have problems even when taking supplements? This comes from taking too many supplements, which you saw have so many foreign things like heavy metals, etc. in them. What I recommend to my patients, they get off all the supplements for 3 weeks first because you don't know what they're getting. Then start with the detox pure supplements because they are pure. I had them tested and they're 100% pure. And do the test first. You have to know what you have and how much of it you have. I've been sick for many years and just had this blood serum antibody test at MyMycoLab. I tested positive for all mycotoxins. I have severe memory loss. I've lost 40 pounds and can't gain weight. I'm starting itraconazole, but should I have a brain SPECT scan? I don't think so. You need it. I don't think you need it. Is it known how long it takes IgE to return to normal after a patient is out of exposure? Without treatment, it doesn't go away. You can have IgE antibodies and then move to New Zealand. It's not going to change what's in your body. It's not going to miraculously dissolve and go away. It's a toxin. It's a molecule. It's in your body's cells. Explain impact of memory loss while under mold. Will we remember later, or did those memories never encode long-term memory? Everything comes back to normal. Where in the body can mycotoxins colonize? 2 places, the lungs and the sinuses. Does it mean it's growing, producing mycotoxins? Yep, it sure does. Would you repeat what NIH officially recognized last week? Molds and mycotoxins? Well, I'm going to put this tea time into YouTube and you can watch it all again. And that way you can see everything. Have you had patients that have relapses and need a second round of treatment? No. And I've been doing this for 35 years. I've treated over 18,000 patients. Can mold cause a CD57 level to be as low as 12, or that would be more attributable to Lyme? I don't think you saw what I showed about Lyme. CD57 is bunk. I have questions about the Detox Pure Pack. A patient has the MTHFR gene mutation and struggles with B vitamins because of that. Are the B vitamins in the Pure Pack methylated? Here's what I have to tell you. There's several studies now that shows that everybody in the United States, about 80%, we all have that. And it was put up in a previous YouTube tea time that I did, showing you that it is not a concern. My kids and I have lived in a sick condo. The black mold was only in the master bedroom, but other molds were in every room and the heating and ventilation air conditioning system. My kid was sicker than me, not attending school and being vertical much, but my MyMycoLab results are worse than hers, but mine are worse than hers. She stopped taking her supplements and I continued. We have a functional dietitian, so good quality and aligns with your protocol. Everybody's immune system are different. I recently spoke to mom, dad, and 4 kids, the youngest one being 14. Excuse me, folks, do you think everybody's alike? It's not. You know of couples that get the flu and one gets well in 2 days and the other's sick in bed for a week. Everybody's immune system, don't compare. If you rent and need a mold lawyer, check out this person. Okay. Tracy, your gift, I'm still searching for one. Happy to help. Her family was Shia, etc. Those are legal things. My specialist has us on thorn stress B complex. Good luck. Really good luck because, okay, never mind. You'll eventually understand. Can severe memory loss reserve after treatment? You come back to normal after treatment. Yes. Have kids with mold as young as 1 or 2. They cannot swallow pills, obviously. Is there an option? Do they need melatonin or PS? Yes, they do. The option is, and this has to be discussed differently because it depends on how much they weigh. But yes, that is the way to do it. It has to be done according to weight. So obviously, if you're 280 pounds, you need a different dose than somebody that weighs 140 pounds or somebody that weighs 70 pounds. And that's common sense, and you understand that. I would do immunosciences B. I started on 100 milligrams. Do I need to get up to 400? No, it's 200 a day, 100 in the morning, 100 in the evening with food. Do you use nystatin? No, nystatin only works against single cell molds and it's a very weak antifungal. Is it safe to use itraconazole with significantly elevated liver function and GGT? That's something you need to discuss with your doctor. Why do you have high liver function tests? What is the cause of that? That's what you need to find out. How can we understand this when we have mold and brain fog? Well, that's a very good question. You have to review it again and again and again and again. Can an area of completely can an area be completely infected? I don't know what you mean by an area. Like we have 3 acres when we moved back to break ground, and I got, okay. How many square feet is indoors? 2, 3, 4,000 square feet at the most? How many square feet outdoors? Trillions and trillions. There's over millions of moles outside. They don't affect humans. There's only about 20 that affect humans, and they're when they grow indoors. I got my now 9-year-old functioning ASD son stem cells last September and moved Neurotoxin. He was a different kid by the end of the week. And was that just a coincidence? I don't know, ma'am. If you would please go to YouTube's MyMycoLab's YouTube channel, I have a whole program there, video that I showed on autism kids, because I treat a lot of autistic kids, and I've done so for the last 30 years, and they're well. They're well after a few months of treatment. They're back to normal. Curcumin, we don't tolerate it. Also, we don't tolerate bioflavonoids, high salicitates. So is it just our genetics or years of chronic mold exposure? First of all, I showed you in this program how many of these supplements you can buy all over contain all kinds of contaminants. And this is why I tout Detox Pure. Second, you have to take the right dose and only 8 supplements. They don't include bioflavonoids, by the way. Phosphatidylserine helps with sleep too when you take it at bedtime. Yes, it can. What about phosphatidylcholine? There's no studies that show it does anything. Phosphatidylserine has double-blind, placebo-controlled, randomized studies showing it works, not phosphatidylcholine. Though I go by medical evidence, not by what people say, not by Dr. Google, Dr. Facebook, or anything like that. Can you get rid of SIBO with Sporanox only, or do you sometimes treat it? You saw that woman. She was 30 years old with SIBO. She took the program with the points, the 4 points. It's not that complicated. There's only 4 of them. She followed those 4 and got well. No, suppositories are no, and the dosage is the dosage given for melatonin that comes in with detoxpure.com. Do you have CMPs done regularly? I'm not sure what you mean by CMPs done regularly. I just have liver function tests done every 2 to 3 months. We have normal levels of magnesium. You still need the magnesium? Absolutely. Well, how did you do the magnesium? Was it red blood cell magnesium or was it serum magnesium? Because there's a big difference. What types of magnesium? That's a very good question because there are 6 types. So the magnesium from Detox Pure comes with 3 of the best. There are many magnesiums. Yes, that's correct. There are 6 of them, not many, but 6. The 3 that help come in the Detox Pure box. Okay, and all you got to do is go to the website and they tell you. Alrighty, are you supposed to stop all medications besides the one recommended? I take sleep aids. All those are treating your symptoms. Are they treating the cause or just the symptoms? So remember the first few slides, I said, identify the cause, remove the cause, repair the damage. I have insomnia as a result. I'm currently following the detox regimen. Are you following it at all points? Then everything will come back to normal. Do we take the supplements at the same time or throughout the day? Some you take at bedtime, like melatonin. Others you take in the morning, etc. Should I do high dose of IV vitamin C? That depends on your doctor. I don't do that. I think that taking the dosage by detox pure is enough. So is VC also a rescue remedy in addition to taking it once each morning? No. What to give a 4-year-old that has nightmares from melatonin? It's a combination that helps. It's not just one thing. Remember what I said in the slides. It's like a four-legged table. You take one of the legs away, the table falls over. Do you have all these mycotoxins? Do you automatically have candida? No. If mycotoxins are not living molecules, why do we need to take a medicine that kills it? Very good question. Molds produce mold spores. Mold spores carry mycotoxins. You kill the spores, you kill the source of the mycotoxins. There have been some exciting developments in the last few weeks with regards to recognition. The NIH updated our website to include symptoms. And Robert F. Kennedy Jr. has twice stated mold needs to be investigated, etc. Thank you so much. Do you plan to apply for these grants in particular? I don't really need to do so. I've published over 100 studies. On top of that, I teach at 2 medical schools, and I've lectured at Harvard University and Oxford University in England. I don't need any more grants. Can methylene blue be incorporated in small doses while on the protocol? As I said, adding anything or deleting anything changes the whole protocol. You cannot do that. And by the way, there's no evidence that methylene blue does anything to mycotoxins. The only evidence is that sometimes it can have an effect on single cell molds. Detox Pure has some small capsules that are too small to split up for a 4-year-old. Okay, so you open the capsule and you use what's enough for a 4-year-old, and you need to discuss that with your doctor. But I mean, I treat 2-year-olds, 3-year-olds, 4-year-olds, 5-year-olds, etc. Depending on their weight is how much you dose the person. Is there a list of how much each dosage of vitamins? I've bought all the vitamins suggested. What is a high dose? Like active B complex. I take one, but is that high? I don't know where did you get these from Detox Pure or somewhere else? Because if you got the Detox Pure, you just take one a day and that's it. My daughter is finishing up her first 30 days of itraconazole and supplements. Should she have? No, after you can if you want, but really it's up to your doctor. In my patients, I usually do it every other month, but it's up to you and your doctor. Can the capsules and the Detox Plus Element supplements be opened up and taken that way with water food? Absolutely. I feel very dizzy on itraconazole. Are you taking the whole treatment and are you out of the moldy environment? Now that the NIH is beginning to acknowledge the significance of mold, do you think that other organization will soon follow? Who knows? How do I get info and consult for my results? I got them today. You go to customer service at MyMycoLab.com. What are the possible end results of not treating and taking seriously mold and mycotoxins? My kids are very sick and husband, and they suddenly refuse to listen. Well, mycotoxins are carcinogenic, nephrotoxic, toxic to the kidney, toxic to the brain, toxic to the liver, toxic to the bone marrow. They cause genetic defects. They change DNA and RNA. I can confirm about glutathione making you worse. I took it for about 2 weeks because it's blowing up all over the internet right now and claiming it makes you feel great. I couldn't get out of bed. I was told it was detox. Nope. Don't believe it at all. It was making me much worse. That's correct. Thank you for sharing. I had sushi once, and for a time after that, dealt with migrating muscle pain, labored breathing, and fatigue. Are those signs of methylmercury poisoning? Yes. I ordered the blood test, but the Adderall or itraconazole need to be stopped prior to blood. No, you don't need the medications don't affect it. Does mold cause EGPA vasculitis symptoms? It can. How do you prepare your body for detox or die off? In my patients, about 3% have die off, which means 97% are fine. So if you took a lot of supplements and the wrong kind, et cetera, as I said before, stop your supplements for 3 weeks and then start fresh. I started one cap every other day for a week, then every day, second cap every day for a week, etc. I'm so sensitive, I had to start slow too. Okay. I'm a 40-year-old woman, and I found I wasn't producing testosterone. Found I have both severe levels of mold mycotoxins, IgE and IgA antibodies. This seems to be exposure from childhood. Can 6 months still be timeline for moving mold? No. You're talking about mold, which is pathogens, and I'm talking about mycotoxins, which are toxins. You need to know the toxins. Molds are the gun. Mycotoxins are the bullet. You need to do the testing with MyMycoLab.com. How long to wait after leaving mold to start protocol? Next day. Are there any studies showing the benefits of hyperbaric oxygen therapy to help treat mycotoxins? Have you seen conjunctive therapeutic treatments beneficial in treatment with mycotoxins? I'm a good friend of the person who wrote a textbook on hyperbaric oxygen treatment, and it's known as the oxygen miracle. This is a doctor who studied this in New Orleans for many, many years. His name is Dr. Paul Harsh. And Dr. Paul Harsh has been using HBOT for decades. He's as old as I am. We're good friends. He actually gave me his book and signed it for me. There are no benefits of HBOT. I asked him that specifically. Mold mycotoxins affect all hormones. Thyroid hormone, cortisol, estrogen, progesterone, testosterone, all hormones. So yes, they do affect it. Patient has a bronchoalveolar lavage and the fungal culture is completely negative. Could mold exposure still be causing productive cough? Yes. Mold spores are 2 to 4 microns thick, and they're inflammatory. Hair is 100 microns thick. You can't see it on a X-ray or CT or MRI. And a bronchoalveolar lavage does not go deep enough because these mold spores go all the way into the alveoli, and that's not accessible to bronchoalveolar lavage. Does itraconazole remove mycotoxins from the brain and decrease neuroinflammation? Yes. I have heard a doctor saying that to treat heavy metals and parasites first because they form biofilm around mycotoxins. No, that's not. Again, I go according to published studies, not according to whatever is popular. Dr. Campbell, you have spoken often of the professional who understands building and content contaminated with mycotoxins and how to contend with them. Can you provide us with the contact of this person? Does he provide educational presentations on his expertise like you do on yours? Yes, it's Brantley May, at envirohealth.co. ENVRO, envirohealth, one word, .co. Is getting our testing done by your lab? It's not my lab. I'm just an advisor. Will we get weight-specific dosages? Yes. I'm not going to prescribe. If you go to LabCorp and you find out you're pregnant, are they going to deliver your baby? No. Labs don't do that. However, MyMycoLab can help you find someone in your area that knows this, or refer you to somebody that knows how to treat it and can prescribe. Actually, there are outside toxins that do hurt people who are hypersensitive. Show me the medical evidence, please. Because as the editor-in-chief for 5 medical journals, I have not seen that. Are you taking new patients, children? In certain specific cases, can mycotoxins cause low stomach acid? One patient has SIBO and has had mold toxins, and she's been on stomach HCl supplementation for a while. Mycotoxins can change DNA and RNA. They can cause anything. Will HBOT help with inflammation caused by molds? I'm so sorry, no. When do you take all the supplements? With the itraconazole in the morning, with food? No, it tells you when to take it on each bottle. Do you need liver function tests while on the protocol? And if so, how often? It was in the slide I showed earlier. Where do we get the mold testing for house and auto? Immunolytics.com. What side effects from itraconazole would make you consider changing to Sporanox? It's the same thing. One is generic and one is name brand. They tell me Sporanox is hard to get. I'm so sorry. It's easy to get in the States, anywhere, in any country. Can any doctor write a prescription for? Yes, any doctor can. How long do kids stay on protocol? 6 months. How long do you think it would take to see results on skin issues? As I said in one of the slides, it takes 8 to 10 weeks. How long do kids stay on for 6 months? Okay. Hard to get a doctor prescribe itraconazole, but I know who to go to, so just shoot me an insurance. I'm sorry, just shoot me an email. I had to cry to my mom's doctor and begged for help. However, I know some nurse practitioners don't care and will do. Paid cash for the medication. Well, thank you for that information. We all appreciate it. That's very helpful. Thank you. Thank you. You don't need a prescription for it on Good RX. Yes, that's correct. Good RX works. Okay. I'm allergic to mold spores. Can I be allergic to spore-based probiotics? Okay, the probiotics are from bacilli that form spores, not molds. It's as different as a table and a banana. Due to different support groups, I was told mycotoxins transfer to your clothes, throw it all away, and so forth. Yes. On steroids, yes, you cannot, any immune suppressants, you cannot do the testing, any immunes on any antibodies. It doesn't matter if it's MyMycoLab or any of them. I have arthritis. By the way, if you are on steroids and all that, you get off for 2 months and then you can do the testing. It alters almost every blood test known to humankind, by the way. I have arthritis in several parts of my body with pain for 12 years. I've taken a combination of astaxanthin, curcumin, omega-3 combo completely eliminated my arthritic pain. Should I stop these 3 supplements during the 6 months? No, I would continue on them. I mean, it's just logical. How does the mold get eliminated from the body if not taking binders? I showed you the slides. Binders don't work. They tell you they work, but they don't. It's a bunch of hooey. Could you go into more detail about the difference of what IgE and IgG measures and how they work together? They're completely separate reactions by the immune system. IgG tells you how much mycotoxins you currently have in your body causing a toxic reaction. IgE tells you if two things. One is if you're having a mast cell activation, and two, if you're currently being exposed. My hormones are off: estrogen, progesterone, testosterone, hypothyroid. Should I still continue taking all my prescriptions for long? Yes, because it's due to the mycotoxins. Currently on Detox Pure, starting to get small bumps on scalp. Now on back. Could this be folliculitis? If so, how do I treat it? You don't. Don't treat symptoms. It's your body's way of getting rid of toxins. You get it through the skin is the largest organ of the body. That's why sweating is helpful. Would mold and mycotoxin exposure cause hair thinning and loss? Yes. How does itraconazole remove mycotoxins from the brain and decrease neuroinflammation? Please. I have several videos on MyMycoLab's YouTube channel that go into the specifics of the brain and how it does that. Please watch those, and they all have references to the studies. And I published a study that's a chapter in a medical textbook on that precise thing. I live next to a wastewater company. They process water. Is it true they emit mycotoxins in the air? I don't know. I don't think so. Do you recommend a binder before infrared sauna? I don't recommend. I just showed several studies on binders that show they don't work. So please review this. You're asking me something that was already shown earlier today in the program. Is it normal for menstrual cycle to hormonal fluctuation? Absolutely. Mycotoxins can change DNA and RNA. Would my generic testing be changed? Yes, it will. Is it okay to take testosterone supplementation while on the protocol? Yes. Sporanox is around $1,000 per month. It depends on two things: where you live, what state, what location, what city, and what insurance plan you're on. Can patients have a negative antigen test for aspergillus but positive? Yes. Should you stop H1 and H2 antihistamine for MCAS while doing your protocol? Well, it's going to make it all go away. You can continue it for a while, but why? Sincerely, thank you for your kindness and time to go through all these questions. This meeting has been beyond helpful and life-changing. Thank you. How many years in the past can IgG indicate? IgG to a toxin indicates current exposure. IgG to a pathogen indicates sometime in the past when it could go back to as far as you were a baby. So there's a difference between a pathogen and a toxin, which is only a molecule. Pathogens are living organisms. Molecules obviously are not. The WHO estimates over 70% of buildings have mold. How would you recommend a patient confirm their new environment doesn't have mold? That is a question from envirohealth.co. How can a patient have negative antigen tests for aspergillus? Because aspergillus is a living organism. Mycotoxins are toxins. One is a cell that's alive and has cell walls. The other is a molecule that's a toxin. Why do some people take more than 200 milligrams of itraconazole and is ever necessary to more? Yes, the more you weigh, the more you need. Thank you for your time, and never change your bluntness. Thank you. I never will. All right, folks, take care. Have a good evening.